Hello students, this is Dr. Harshit Jain. So topic for today is humerus. In practicals, humerus is generally asked and we'll see how to define it better in the exams. So humerus is attached to the glenoid cavity. This is the glenoid cavity and it is attached to the glenoid cavity. The joint is ball and socket joint. Ball and socket synovial. Ball and socket synovial joint. Okay. So ball and socket synovial joint, and on the lower aspect this forms the elbow joint. Elbow is a hind joint synovial variety. Hind joint synovial variety. Okay. So these are the two joints formed by the humerus. First is ball and socket joint with scapula, and elbow joint is formed between the humerus, radius and ulna. It is a hind kind of variety of synovial joint. So this is the anterior aspect of the humerus. So we'll see some features. This is the greater tubercle going on the posterior. On the lateral aspect of the bone, greater tubercle. On the anterior aspect we have the lesser tubercle. This is the greater tubercle, this is the lesser tubercle. This is the deltoid tuberosity, and this is the sulcus, intertubercular sulcus. Between the two tubercles there is a sulcus known as intertubercle sulcus. Then we can see this is the anatomical neck. The anatomical neck is formed at the junction where the head meets rest of the humerus. The head is the spherical portion. When it meets the rest of the humerus, there is anatomical neck, and we have the surgical neck also. This is the surgical neck. It starts where the tubercles end. Okay, where the lesser tubercle is ending, if there is a constriction, this is the surgical neck. Okay, this is the surgical neck. Then we can see this is the supracondylar ridge on the lateral side and on the medial side also. Then on the medial side we have condyles, we have trochlea, and we have capitulum on the lateral side. These are the condyles. On above the capitulum, on the anterior aspect we have radial fossa. And on the medial side above the trochlea we have coronoid fossa. Then we have lateral epicondyle and medial epicondyle. Okay, so these are the features on the anterior aspect of the humerus. So we'll see the head of the humerus. We can see in blue color head of the humerus. Then the anatomical neck. This is the anatomical neck. Then we have lesser tubercle on the anterior aspect, and on the lateral aspect we have the greater tubercle, and we have surgical neck. The constriction at the junction of the shaft of the humerus with the upper end is known as the surgical neck. So we can see the attachments of the tubercles. On the lesser tubercle we have subscapularis. The subscapularis is a part of the shoulder cuff or the rotator cuff muscles. So subscapularis is on the lesser tubercle. It is the four muscles are the rotator cuff muscles. One on the lesser tubercle, that is subscapularis. The other three are on the greater tubercle, the supraspinatus, the infraspinatus, and the teres minor. These are the four rotator cuff or shoulder cuff muscles. On the lower end we can see the coronoid fossa and the radial fossa on the anterior aspect. We have the trochlea and we have the capitulum. On the posterior aspect we can see the olecranon fossa. In the olecranon fossa the olecranon process of the ulna fits, and on the coronoid fossa the coronoid process of ulna fits. In the radial fossa, head of the radius bone fits. Okay, so this is the radial fossa, this is the coronoid fossa, this is the coronoid process. It will fit into the coronoid fossa, and the head of the humerus will fit into the radial fossa. The head of the radius will fit into the radial fossa. Okay, and this is the olecranon process we are seeing from the posterior aspect. This is the olecranon fossa. This is the olecranon process. It will fit into the olecranon fossa. It will fit into the olecranon fossa of the humerus. The olecranon process of ulna fits into the olecranon fossa of the humerus. Okay. Then we can see the supracondylar crest and the lateral supracondylar crest or ridge. This is the attachments on the anterior aspect of the bones. Anterior aspect. So we can see the coracoid. This is the coracoid process of the scapula. Here comes the coracobrachialis and the short head of biceps brachii. The short head of biceps brachii and the coracobrachialis. Coracobrachialis will attach here. Coracobrachialis will attach here on the middle of the medial border of the humerus, and the biceps brachii will attach on the radial tuberosity. The radial tuberosity of the radius bone. We have already seen the subscapularis, and on the lateral tubercle we have the three muscles: supraspinatus, infraspinatus, and teres minor. So we have intertubercle sulcus. It has three parts: the medial lip, the lateral lip, and the area between them. This is the medial lip, this is the lateral lip, and the area between them. So what will be the attachments? On the medial lip we have the major. Which major? Teres major. And on the lateral lip we have pectoralis major. On the in between them we have latissimus dorsi. So the mnemonic will be a lady between the two majors. See, a lady between the two majors. So two majors are the teres major on the medial lip, and on the lateral lip we have the pectoralis major, and in between them we have a lady which is known as the latissimus dorsi. On the latissimus dorsi, this is the coracobrachialis attachment, and on deltoid will be attached on the deltoid tuberosity. This is on the lateral part of the middle of the humerus, the deltoid tuberosity, and the deltoid muscle is attached on it. The brachialis will originate from the anterior half of the brachialis will originate from the lower half of the anterior aspect of the humerus. So it is the lower half. The brachialis will originate from it, and it will attach on the ulnar tuberosity of the ulna bone. This is the ulnar tuberosity. Brachialis will attach on it. This is the attachment of the biceps brachii on the radial tuberosity. Ulnar tuberosity, brachialis, radial tuberosity, biceps brachii on the and this is the lateral supracondylar ridge. The upper two-third is for brachioradialis, and the lower one-third is for extensor carpi radialis longus. We can see the pronator teres origin, and this is the common flexors and common extensors. Common flexors are on the anterior aspect of the medial epicondyle, and the common extensor is on the lateral condyle, both are on the anterior aspect. See, uh, this is the anterior aspect. You can see the head. This is the head, supraspinatus. On the upper, impression on the greater tubercle, subscapularis on the lower, lesser tubercle, subscapularis on the lesser tubercle, pectoralis major on the lateral lip of the intertubercle sulcus, latissimus dorsi in between the two majors. The two majors are the teres major and pectoralis major. Deltoid tuberosity on deltoid muscle on deltoid tuberosity. Coracobrachialis on the rough impression in the middle of the medial border of humerus. Brachialis in the lower half of the anterior aspect of humerus. On lateral supracondylar ridge, if divided into 2/3 upper part, 2/3 upper part brachioradialis, and 1/3 lower part is the extensor carpi radialis longus. The common extensor origin, common flexor origin, pronator teres. Then we should see the capsular arrangement. The capsule of the shoulder joint is near the anatomical neck, near the anatomical neck of the humerus. This is the shoulder joint capsule on the humerus. No, lesser and greater tubercles are outside the capsule, while the elbow joint capsule contains both the fosses and both the condyles. This is the radial fossa, this is the coronoid fossa, and on the posterior aspect also it contains the olecranon fossa. If we see on the posterior aspect, we have the greater tubercle, supraspinatus, infraspinatus, and teres minor. If we see, there is a groove on the posterior aspect of the humerus which is going from medial to lateral. It is related to the radial nerve. Above the radial groove, we have the attachment of the lateral head of triceps, and below the groove we have the medial head of the triceps. Long head is not attached to humerus. Long head comes from the infraglenoid tubercle of the scapula. We have the deltoid tuberosity for the attachment of deltoid muscle. We have the Newton foramen in between. So this is the nerves related to the humerus. This is very commonly asked question. So this is the surgical neck. Surgical neck is related to the axillary nerve and posterior circumflex humeral artery and vein. Okay, and in the radial groove we have the radial nerve and profunda brachii artery. Okay, and on the behind the medial epicondyle we have the ulnar nerve. There is also a process known as the supracondylar spur. Attached to it the Struthers ligament. Okay, this is the spur. Attached to it on this is present on the medial side. Medial condyle. Medial condyle is the trochlea. This is the capsule present on the lateral side. So this is the PPT. Now we'll go to the 3D app. So this is the 3D anatomy app. So we can see the 3D version of humerus. So we can see this is the lesser tubercle, this is the greater tubercle, this is the medial lip, this is the lateral lip of intertubercular sulcus, this is the radial fossa, this is the coronoid fossa, and this is the capitulum, this is the trochlea. Okay, this is the trochlea. Okay, and this is the deltoid tuberosity. This is the deltoid tuberosity. So if we see on the posterior aspect, we can see a groove. This is the 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 groove. This, from this groove is passing. This is the groove. This is the groove. In the groove is the radial nerve passing. And we can see from behind. This is the olecranon fossa. This is the head of the humerus. Here will be the surgical neck. Okay, so this is the humerus for you. So now coming to some clinical things. One is the tennis elbow. One is the golfer's elbow. So tennis elbow is the inflammation of the lateral epicondyle, and golfer's elbow is the inflammation of the medial epicondyle region. One is supracondylar fracture of humerus, which may lead to the injury to the brachial artery. If the injury to the brachial artery takes place, the condition arises which is known as the Walkman's ischemic contracture. Surgical neck fracture may injures axillary nerve, because axillary nerve is related to it. So I hope I have covered all the aspects of humerus. There is a separate video on the anatomical position and the site determination of humerus, the link of which I will give in the comments. Okay, thank you.